So I just want to give you a little bit of a context of where I'm coming from. I represent the Frontenac, Lennox, and Addington OHT, and so you can see the visual. Our attributed population is very close to our geographical sort of, I guess what I would say, boundary. So you can see that we have about 220,000 people in our FLA OHT, and we span both rural and urban areas, which not all OHTs do. So we have both of those lenses on our mind. We have a slightly older population. We have also a population that's fairly homogeneous from an ethnicity perspective. Approximately 95% of our people have English as their first language. We do have a higher proportion of French speakers at about 3% as well. Our focus in our region is very much from a primary care lens. Our flow-through agency is actually a community health center, so it keeps us very grounded from a primary care lens, and really that is our main focus in our OHT. And you can see we've got people around the out as core to our OHT. Our objective is to have everyone in our region have a health home. And so again, thinking about that health home and primary care, and many people have heard, I'm sure Dr. Jane Philpott speaking now of her focus on a neighborhood sort of focus model, and that's very much informed our work and in turn our evaluation in our region. And I wanted to highlight this because this is our organizational structure. And I just want to say from the very, very beginning of our OHT, when we started to come together to write our application, evaluation was at the front and center of all of the discussions. So not only did we have to actually submit what our outcomes and indicators were going to be, but again, we were thoughtful from the start of how we can actually shape our work from keeping that evaluative lens to inform us as we went along. So you can see one of the core support structures is our evaluation group, which is on our transitional leadership collaborative as well. And you can see that all feeds into our primary working groups, which I'll speak to in a moment. So we have decided to focus exclusively from a Quest group on looking at how we can evaluate the concept of health homes and this idea of having care closer to home through a neighborhood focused approach. So we've honed down our logic model to think exclusively on the processes and the characteristics of primary care and the health outcomes associated with a health home model. So we've decided now to, again, frame everything around the health home in the last 4 years. And we're looking at 3 targeted activities for this year. One, we're focusing on getting the patient experience and wellness out to our primary care network. And we actually have a data support person that's going to be focused specifically on this role. We're looking at working to map our neighborhoods. And so we're working with the Community Health Profiles Partnership to actually break down our region into neighborhoods so we can start to align primary care with our neighborhoods in line with the focus of health homes. And we're in the midst of meeting with each of our primary care teams to look at the current state of where they're at in moving towards what we see as our health home model. So again, it's been a meandering path, starting from when we first got together to build our priority groups. And what we've really learned along the way is the crucial need to align outcomes and indicators across the many projects that will be happening in your OHT. Working closely, and again, Walter alluded to this, like with partners as much as you can to coordinate the data that's coming in. We have several large evaluations that are being conducted in various projects in our OHT, and working with those larger evaluation projects to make sure what the data they're collecting, how it aligns with our focus on moving to a health home. And again, thinking about really focused on that routine deployment of our patient wellness experience survey. We've heard from our council that what they really want to know is about the wellness and the health of the people in our networks, and really focused on getting that wellness data. So I guess I would say to everyone on the call, stay focused and have a plan. Bite-sized projects, again, we started very large and we worked our way down to much more focused, and build on your work slowly over time, each of your learnings, and we'll get you there. I'll just end on that last slide. Thank you.